Thank you so much for joining me today. I'm Joanna Bell, registered dietitian, and I wanted to spend a few minutes today talking about how to eat to maintain a happy colon. Maintaining a healthy GI tract is just as important as protecting your brain and your heart. Your digestive system moves food through your body by a series of muscle contractions. Similar to squeezing a tube of toothpaste, these contractions push food along your digestive tract. As we age, this process can slow down, and this can cause food to move more slowly through the colon. When things slow down, more water gets absorbed from food waste, which can cause constipation. There are also conditions that may cause your digestive system not to work properly, such as diverticular disease, irritable bowel syndrome, and colorectal cancer. It is interesting to note that colon cancer is the third most common cancer and the third deadliest cancer in the United States. So what you eat and how you live are extremely important in preventing and treating these conditions. While talking about our digestive health can be an uncomfortable topic, it is important to learn how to make your colon smile. So what is a happy colon? When you have a happy colon, you have regular bowel movements that are soft and easy to pass. The frequency can happen 1 to 3 times a day, or even as little as 3 times per week. In 1977, the Bristol chart was developed by physicians Stephen Lewis and Ken Heaton. They created a chart to classify human stools into 7 categories, with type 1 being separate hard lumps, also known as constipation, to type 4 being smooth or ideal stools, and type 7 being liquid with no solid pieces, also called diarrhea. A sad colon would be type 1, which would be the hard lumps or constipation. A sad colon would also include diarrhea, bloating, or gas. A happy colon is type 4. A happy colon means you should be able to do the following. You should be able to hold on for a short time after feeling the urge to have a bowel movement without having any accidents. Pass a bowel movement within about a minute of sitting on the toilet. Pass a bowel movement without any pain or straining, and completely be able to empty your bowel. Do you have a bowel movement every day? If not, does that mean you're constipated? The answer is no. Everyone can have different bowel movement patterns. As I mentioned earlier, for some people, normal frequency can be 3 times per week. So how common is constipation? A lot of Americans deal with constipation on a regular basis. Women tend to experience it more than men. This may have to do with the slower movement of food through a woman's intestines, as well as the effects of female hormones on the GI tract. It is hypothesized that infrequent bowel movements increase colorectal cancer. The reason behind this hypothesis is that constipation increases the duration that toxic substances are in contact with the colon. So what is constipation? Constipation is defined if criteria are met and symptoms have been lasting for at least 3 months. Some criteria used to evaluate include the following: straining during at least 25% of bowel movements, lumpy hard stools in at least 25% of bowel movements, sensation of incomplete evacuation for at least 25% of bowel movements, and fewer than 3 bowel movements per week. Constipation may be a secondary symptom of other diseases or conditions, such as obesity, inactivity, irritable bowel syndrome, inadequate fiber intake, stroke, diabetes, spinal cord injuries, just to name a few. Certain medications may also contribute to constipation, such as iron supplements, pain medications with codeine, medications for depression, calcium supplements, and some blood pressure medications. In addition to the discomfort constipation can cause, there are additional complications that arise from constipation, which are hemorrhoids and tears in the skin around the anus called fissures. If you strain too hard, you can even cause part of your intestine to push out through the anus, which is a condition called a rectal prolapse that sometimes requires surgery. Diarrhea is classified as having frequent liquid stools, which results in the loss of electrolytes and fluids. This happens because stool rapidly moves through the intestines. Diarrhea can be caused by the following: food that is poorly absorbed, such as lactose, bacteria or viruses, diseases like Crohn's disease, and medication like antibiotics. I will touch on each of these, but the way to a happy colon would be to increase your fiber intake, drink plenty of fluids, add pre- and probiotics to your diet, and exercise and stretch more. The recommended amount of fiber we should consume is 25 grams per day for females and 38 grams per day for males. However, the average American diet contains relatively low levels of fiber. The average is around 13 grams per day. This is largely related to the increased intake of fast foods with insufficient amounts of fruits and vegetables in the diet. It is thought that inadequate fiber intake contributes to the high prevalence of constipation in the United States. Dietary fiber has been proposed as a protective factor against colorectal cancer. Slow initiation of fiber into the diet over a period of 1 to 2 weeks may help reduce the unpleasant side effects of increasing your fiber intake, such as increased flatulence, intestinal rumbling, or diarrhea. The digestive tract moves digested material through the intestines and colon by producing wave-like muscle motion. You can visualize squeezing that tube of toothpaste again. By increasing bulk to the stool, which is done by adding more fiber, the stool pushes more against the walls of the intestines, which then helps to move the stool along easier and faster. Fiber helps stimulate this process more. Besides adding bulk, fiber also attracts water to the stool and absorbs water to form a gel. Increased water helps the stool to move along the colon easier, making it soft and prevent straining. Fiber does need adequate water. Insufficient water and increased fiber intake can cause severe constipation. Now, I know some of us are not water drinkers, and water does not have to come in the form of just plain water. It can be any liquid, such as tea, coffee, milk, fruit juices, or soft drinks. An easy way to increase your fiber intake would be to eat oats at breakfast and add legumes to your diet a few times during the week. Individuals who consume mostly fruits and vegetables will likely not need to count fiber, so make half your plate fruits and vegetables, and your fiber will start to add up fast. Fiber is formally classified into two main types: dietary fiber and functional fiber. Dietary fiber is naturally found in foods. It is intact plant components that are not broken down by the digestive enzymes. Dietary fiber can include soluble fiber, which attracts water, and insoluble fiber that does not attract water. Functional fibers are non-digestible forms of carbohydrates that have been extracted from plants or man-made. They may have some of the benefits of naturally occurring dietary fiber. Functional fibers can be added to foods, drinks, and supplements to boost their fiber content. Common types of dietary fiber are cellulose, lignin, gums, and pectin. Cellulose is insoluble and found in foods like whole wheat or bran. Cellulose adds bulk to the stool by increasing undigested particles' ability to hold water. Lignin is insoluble fiber found in flax seeds, vegetables like broccoli and cabbage, and fruits like apricots. Gums are soluble fiber found in oats, legumes, and barley. Gums become a gel which slows digestion. Pectin is a soluble fiber found in foods such as apples, strawberries, and carrots. Pectin binds to fat and bile to help lower cholesterol. Good sources of insoluble fiber are foods like kidney beans, pears, flaxseed, raspberries, green peas, sweet potatoes, and okra. You will want to consume insoluble fiber to help you stay regular. When you have diarrhea, it's best to decrease insoluble fiber and increase soluble fiber to thicken stool and help slow down how fast stool travels through the intestines. Good sources of soluble fiber would include oatmeal, mango, Brussels sprouts, oranges, figs, and black beans. Foods can contain both soluble and insoluble fibers. If you'll recall, functional fibers are non-digestible forms of carbohydrate that have been extracted from plants or are man-made. Psyllium is a functional fiber. You're probably familiar with the brand Metamucil. Metamucil is considered a fiber laxative. It will aid in bulking the stool. It's gentle on the body and safe to use long term. Water is essential for preventing constipation. Most people should aim to drink 8 cups per day. Fiber needs water to work properly. Water will help keep stools soft, making them easier to pass. As I mentioned earlier, fluid does not have to come just in the form of water. You can get fluids from other beverages, even liquids from soups count. Prebiotics and probiotics are important to the colon's health. Prebiotics promote the growth of beneficial bacteria in the digestive system. Probiotics are good bacteria normally found in the human body. Probiotics can help strengthen your immune system and support healthy digestion. Probiotics have been modestly successful in treating antibiotic-related diarrhea, traveler's diarrhea, and bacterial overgrowth diarrhea. The probiotics help reestablish good bacteria in the intestines. To obtain probiotics, try eating fermented dairy foods like kefir or aged cheeses that contain live cultures. Yogurt also contains probiotics like lactobacillus or bifidobacteria. It is important to look on the label of products for live or active cultures. Other good sources of probiotics are sauerkraut or miso soup. These items involve fermentation, a process in food making that produces probiotics. Prebiotics are foods that act as food for human microflora. Prebiotics are in foods such as whole grains, bananas, greens, onions, garlic, and artichokes. Prebiotics are the fuel needed for probiotics to work efficiently. You could easily get both into your diet by eating a banana with yogurt. This would provide you with both your prebiotic and your probiotic. Laxatives are used by roughly 20% of the United States population. One study reported that about $821 million was spent on over-the-counter laxatives in the United States. Long-term use of laxatives can weaken the colon's ability to produce the wave-like motions and can actually worsen constipation. Prior to using laxatives, first determine if it truly is constipation. Remember, bowel movements vary between people. Before turning to laxatives, try a few lifestyle changes, like increasing your intake of fiber, drinking plenty of fluids, exercising, and trying to establish a regular bowel movement pattern. Optimal time for having a bowel movement is usually within the first 2 hours after waking and after breakfast. Osmotic laxatives draw water into the bowel, making it easier for stool to pass. Examples of osmotic laxatives are milk of magnesia and Miralax. Older adults and people with heart or kidney failure must be careful when using these medications. Osmotic laxatives work by bringing more water into the colon. It draws the water from the surrounding tissue. As a result, people may experience nausea, increased thirst, and diarrhea. Stimulant laxatives such as Dulcolax and Synacot work by stimulating wave-like contractions to move stool along. Both types should be used with caution and under a physician's instruction due to the risk of dehydration and electrolyte imbalance. Docusate and Colace are examples of stool softeners. Stool softeners mix fluid into the stool to make stool softer and more slippery, which makes stool easier to pass. Stool softeners may cause an electrolyte imbalance with prolonged use. Studies have suggested that sedentary people are 3 times more likely to report constipation. Exercising helps decrease constipation by helping the muscles in the colon work efficiently to move the stool along quickly. You should wait at least an hour after eating before doing any vigorous exercise. When exercising, blood will be redirected from the stomach to the heart and lungs. If this happens before food is digested, it may result in bloating or cramping. Gentle yoga may also help keep your colon happy. The image on the left is called the downward facing hero pose. You bend forward with your arms straight out in front of your head. You would hold this position for 30 to 60 seconds. The image on the right is called the wind releasing pose, which can help with gas. Lying on your back, bring both knees into your chest, breathing as you pull them in. Hold this position for 30 to 60 seconds. A modification for this exercise would be to pull only one knee in and leave the other leg extended. Here's a sample of what a day's meals might look like to reach 25 grams of fiber. Breakfast could be oatmeal with raisins and a sliced orange. For lunch, you could have a toasted cheese sandwich on wheat bread with tomato and an apple. A snack could be a whole grain cereal such as Total Raisin Bran mixed with yogurt. And for dinner, you could have a steak, corn, baby carrots, and rice, which would end up equaling 25 grams of fiber. What I haven't listed here is fluids. Remember, adequate fluid is essential in preventing constipation. If your diet has been low in fiber, you'll want to gradually increase the amount of fiber over a period of 1 to 2 weeks. You could start by adding a tablespoon of ground flaxseed to your cereal, applesauce, or even mix it in with your mayonnaise or mustard on your sandwich. A tablespoon of ground flaxseed is going to contain about 2 grams of fiber. If you have any questions, please let me know. You can also look on the portal for the Happy Colon handout under the Documents section on the portal.